So we're going to go over today how to deal with a JP drain. These are typical in our patients that are C-section readmits that either have a hematoma or some sort of infection. We've had several gynae patients that have it. So you'll see the blue catheter sticking out of the patient, and then there should be a little hub on it. So, and then this is your actual JP bulb, which should be compressed at all times. So first we're going to talk about how to flush this drain. Now you want to double check your orders before you're doing any of these things, but generally a patient who's infected should be flushed once a day. You're going to come over here to the hub and you're going to make sure that you hold the port right above so that you don't pull against the patient. You're going to unhook your JP and it'll just unscrew, and then you'll see it expand and pull all the fluid into the bulb, and that's normal. You're then going to take your flush and you're going to screw onto there, and you're going to go ahead and push the 10 cc's. You're not going to push it all at once because it might be painful to the patient, but you can kind of just go little bits at a time and push it so that it kind of pulsates and breaks up anything that's in there. When you're done, you're going to unhook this. You're going to clean with your alcohol wipe, and you're going to reconnect your JP bulb. So you're going to clean your hub there for your 10 seconds, then you're going to put this right back on there. When you do that, you also need to take the bulb, open the top, squish it again, and reclose it so that it can suck out whatever's in there. Once you've done that is a good time to actually strip the bulb. So what that does is helps pull whatever fluid could be stuck in the tubing into the bulb so that it's not just sitting there and causing a clog. So when you do this, you just need to make sure that you're really holding the part against the patient so that you don't pull against that. So you're going to start at the top. You're going to take your fingers, you're going to run down the tubing and stretch it. When you get to a certain point, stop, take your other hand, bring it back to there, and then go again with the stripping all the way down. Move your hand again, and then pull all the way down. Once you do that, it should be pulling the fluid that's stuck in the tubing into the bulb, and that's all you're going to have to do. Now, once you're flushing it, you want to go ahead and then empty your bulb because you're pulling in the fluid that you just put into there, and then start over again with your eyes and O's on it. You're going to empty this every 8 hours at the minimum, but double check your orders to see what that says. And under the invasive lines and drains is where you'll see a spot for JP and the amount that's coming out of your JP. The last thing we're going to talk about is how to change the dressing. So generally, the orders will say you need to change it if it's saturated or every 72 hours. But again, double check your specific orders. So when you're doing this, you're going to get your supplies. So you want your chlorhexidine to clean around, your post-op drain sponge, and your new Tegaderm. And these are all the things that you're going to need. So when you're going to do this, you're going to pull the Tegaderm from the patient. So again, you want to hold this because it's generally sutured in with one suture. So you're going to peel all your dressing off. So all the way down. Okay. And we're going to peel around. And then what you'll see at the site should be like a suture at the skin line, holding it in. We're going to take our chlorhexidine and we're just going to clean around it. So you'll crack it and you're just going to kind of scrub right around that area that has the suture. You're going to let that dry. Once that's dry, we're going to take our new post-op drain sponge that has the slit in it, and we're going to go around the tubing and just lay it against the patient. Then you'll take your Tegaderm and you're going to stick it right over, holding the drain sponge onto the patient. So anytime this is saturated, the patient should be instructed to change it, but again, verify with your orders. And generally, these patients will go home with the drain and drain care, and will come back within a week to 2 weeks for a repeat IR sonogram.